Hi, I'm Dr. B. I'm a medical doctor and I make medical education videos. ADHD is not diagnosed in a lot of girls that probably have it. Why is that? That's what today's video is about. Research tells us that there should really be an equal number of males and females that experience ADHD in their everyday life. However, if you look at the number of clinical diagnoses in the real world, this just isn't true. And in fact, for every girl that's referred to a clinic, there's up to 16 boys that are referred to a clinic for ADHD evaluation. And even once a diagnosis is made, 3 or 4 boys carry the diagnosis of ADHD for every girl that carries a diagnosis of ADHD. What are the reasons? Well, there's a number of reasons for this. Number one is that the general public knowledge of the way ADHD looks in boys and girls is really not very good. Boys tend to have hyperactivity form of ADHD, which is what most people tend to think of when we think of ADHD. Energetic little boys racing around classrooms, making noise, hollering, pestering others, interrupting teachers, punching each other and other kids. Teachers, parents, administrators, and the general public are well aware of this stereotype, and most research, literature, pop culture, and songs focus primarily on how ADHD is expressed by males. On the internet and on TV, there are multiple sports stars, like Michael Phelps, the Olympic swimmer, whose ADHD and hyperactivity is well known to many. So the less that girls fit into this stereotype, the less likely it is that they'll be recognized and diagnosed by those observing them. This is especially important because girls tend to have a different type of ADHD, and that is inattentive ADHD. This means that instead of running around the room and making noises, they daydream. They look out the window. They can't concentrate on their work. They don't interrupt the teacher. They just don't listen to what the teacher's talking about. They forget their homework. They forget their earrings and jackets and their lunchbox. But this behavior doesn't lead to phone calls from other parents or disrupt everyday class and gym time. Now, there is also significant bias from both teachers and parents who evaluate their students or their own children. There are 2 fascinating research studies. In these studies, they took a large group of teachers and they presented them with a detailed description of a child with ADHD. The story was always the same, and what they did was then change the pronoun and the name of the child so they were either male or female. There was a marked difference in the amount of referral for ADHD support in the male students. And the teachers also considered the male students to be more suitable for ADHD treatment. Now, this bias isn't just in teachers, because parents, on average, underestimate hyperactive symptoms in girls, and the same identical symptoms they identify and focus if they're in a child of a male gender. So the same symptoms they interpret differently depending on the gender of their child. So the general public, teachers, and parents have some bias regarding male ADHD identification, but there is also clinic provider bias. So if a girl does stand out enough to be referred to a mental health professional, she is less likely to be diagnosed with ADHD than a boy is by a healthcare professional, particularly if they see a non-specialized provider like a pediatrician or a family practice physician. So even if she has the same exact symptoms as a male, she is less likely to be diagnosed with ADHD. And often, anxiety and depression, which can coexist as a result of the ADHD, are diagnosed as the primary disorder. And in fact, girls are 3 times more likely than boys to be treated for depression before they are ever diagnosed with ADHD. And probably the largest reason that there is such a big difference between boys and girls being diagnosed with ADHD is that the squeaky wheel gets the grease. Boys with ADHD tend to cause more trouble and exhibit rule-breaking behavior. So parents and teachers and society as a whole are much more likely to actively look for a solution. Because unless homeschooled, kids are usually in a formal school setting. And there are rigid rules that exist, and hyperactive boys continually violate these. So teachers, coaches, principals, counselors, and even other kids' parents have significant motivation to alter these boys' behavior. Whereas girls, because of their inattentive form of ADHD, don't usually break the rules. And on their progress reports, they're reported as being well behaved, bright students. They just need to try harder. And even the few girls who are hyperactive tend to try to work harder to be good and fit in socially than their male counterparts do because of societal pressure on girls. And so on average, girls turn their ADHD internally, experience anxiety and depression, and the school system doesn't recognize this. Girls who are quiet and respectful and don't bother anyone and aren't running around hitting, shoving, and being a problem are on average overlooked, and instead they suffer internally. Now, a final reason girls are undiagnosed with ADHD is the natural difference in maturity between boys and girls of the same age. Studies show that children young for their grade level are much more likely to be recognized with ADHD and diagnosed, and girls on average tend to mature much faster than boys, so they again are likely to be missed. Those are the reasons so many girls are not diagnosed with ADHD when they should be. Thanks for watching. I've included additional reference in the description below. If you've enjoyed this video, please click on these additional videos on loneliness in your brain and locus of control. And please don't forget to hit subscribe.